Welcome to this training in sustainable healthcare, or if you like it, healthcare sustainability. But what do we mean by sustainable healthcare? It is a vast topic and the meaning is in many ways in the eye of the beholder, and there are plenty of different definitions. Sustainable healthcare of course derived from sustainable development, meaning to maintain a certain level of society while not endangering the environment of the future of that society. If we translate that into the healthcare system, we could say that sustainable healthcare is just the way of providing necessary healthcare without endangering the environment, the society, or future generations. The term sustainable healthcare in some cases include preventive health measures, financial sustainability, and much more. If we limit the scope a little bit, it's about reducing the negative impact from healthcare at a reasonable financial cost while not endangering the staff or the patients. The healthcare sector is huge, and therefore just by its size it will have a large environmental impact. In developed countries, healthcare is often around 10 to 11% of the GDP. In developing countries, less than that, but rising. Different studies show that the healthcare stands for around 5% of the global climate impact. Following on that means that the developed countries need to reduce their impact to make room for the developing countries to reach our level of healthcare. It also means that advancement in sustainable healthcare could be implemented directly in some parts of the world without passing the non-sustainable solution Western countries have relied on the last 50 years, and in many cases still are. Many environmental issues in the world lead to health problems and different diseases. Since healthcare is such a big part of the total economy, you can actually state that healthcare is making people sick in the other end due to its big footprint. And more sick people need more healthcare that will generate more environmental impact, that will lead to more sick people, and so on. So what topics are we talking about when we're discussing sustainable healthcare? Here are just a few sustainable healthcare topics that are on the agenda at the moment, and of course there are many more that will be discussed later in this training. Of course, climate is one of the bigger topics today, also in healthcare. Pharmaceuticals in the environment is something that's been on the agenda for the last years and will be in the next coming years as well. Buildings, how you design and maintain green hospitals buildings. Chemicals, the large amount of chemicals both in the supply chains and in the hospitals. Supply chains in general, from human rights in the supply chains to other issues. Logistics, how do we transport staff, patients and supplies across the world in the best way. And the large amount of single-use items that are used in healthcare. When we're talking about the healthcare sector, it's not just the hospitals, the dental clinics and the primary care center. It is also about medtech industry, pharmaceutical and life science sector, and the supply chains that follow on that. Building hospitals, producing plastics for healthcare, food production, logistics and commuting to hospitals, and much more. Sustainable healthcare could be reducing environmental impact from hospital, reducing negative impact from medtech industries, having fair supply chains, but also in the best case scenario, reducing health issues so there is less need from healthcare and therefore less negative impact. So the big dilemma is basically how to balance the need of the patients and the negative impact on the planet and global society. In conclusion, when it comes to healthcare sustainability, dig where you are. Everyone can't work with everything. It could be designing a more energy efficient medtech device, recycling waste at a small clinic, researching new treatment methods that reduce the amount of pharmaceuticals needed, or digital solutions that reduce travel and make logistics more efficient. And it's a joint effort where doctors, nurses, engineers and many more need to put in their part. So why work with sustainable healthcare? Here's a few arguments to take with you from this first lesson. The Hippocrates Oath, first do no harm, make people healthy, no good. It's profitable in many cases, cost savings. There are large financial savings that can be made in hospitals in energy efficiency and other measures. There is a strong connection between health and the environment. Healthcare is a big part of the global economy and therefore have a big negative impact on the environment. Healthcare and healthcare organizations have the same laws and regulations as in any other sector, and those regulations and laws are getting harder and harder. Healthcare often belongs to a public sphere, so healthcare can and should be a sustainability influencer for the rest of the society.